Good morning, leadership team. My name is Tate Vasadka, and today I will be presenting a staffing solution for Wellstar Ackworth Health Park. Wellstar Health System is a nonprofit system that provides complete care across the Atlanta metropolitan area. The quality of care provided, culture, and exceptional caregivers sets Wellstar apart from other health systems. Wellstar's mission is to enhance the health and well-being of every person we serve, and the vision is to deliver world-class health care to every person, every time. The health system contributes towards a healthier community through wellness and prevention care programs. The entire staff plays a crucial role in the high-quality care and patient outcomes. Not only does understaffing impact the patients, but the taxing workload is a major problem for all employees. The goal of this assignment is to propose staffing solutions that will contribute to better patient safety and higher employee retention for Wellstar Ackworth Health Park. Analysis of the current situation shows that Wellstar Health System is doing well financially despite losing somewhere between $400 and $600 million due to COVID-19. Wellstar Ackworth Health Park's location allows it to continue to grow due to favorable demographics with diverse financial base and high growth. In assessing other key quantitative trends, the aging population is creating a need for more healthcare workers while the healthcare workforce is also retiring. According to a study conducted by the American Nurses Association, 50% of nurses do not believe their patients received enough care, 96% of nurses reported fatigue, and 54% reported having an excessive workload. Safe staffing ratios helps healthcare systems provide better and safer services. An analysis of Porter's 5 forces in Appendix A demonstrates how Wellstar Health System is impacted by competition. Wellstar faces an increasingly strong rivalry among competitors because it is always competing with other healthcare systems for more market share. When individuals sign up for healthcare, they can only have one provider and are not able to change companies. The bargaining power of suppliers is a strong force because it is dependent on the services provided. There are fewer suppliers than buyers. The bargaining power of buyers is considered weak force due to customers having no control over the healthcare service pricing. The threat of substitutes is a strong and stable force for Wellstar. Many healthcare customers would rather save money and avoid visiting the doctor. Using the internet, patients attempt to find feasible ways to care for themselves from home. However, there are no substitutes for complete health care coverage plans. This is less alarming for future prospects. The threat of new entrants is low because there are few healthcare systems that dominate the sector. Smaller independent practices with high performance and growth would still not be able to measure up to larger and dominating healthcare systems like Wellstar. Analysis of Porter's 5 forces in Appendix A demonstrates the rivalry among competitors is the strongest force Wellstar faces. The threat of substitutes is another force Wellstar must contend with. These two forces are a result of customers attempting to price shop for their healthcare among competitors in the market. Staffing plans are used whenever there are major adjustments to the workforce. Currently, the COVID-19 virus and an aging population have created a need for more jobs in healthcare. Wellstar Ackworth Health Park will need to hire employees in all areas from office staff to healthcare professionals. This project will increase office staff members in order to manage administrative jobs and hire healthcare professionals who can focus solely on providing quality care for patients. The goal of this is to improve patient-centered care and outcomes. This will reduce Wellstar Ackworth Health Park's chances of lawsuits and malpractice due to understaffing. According to the Federal Office of Inspector General, inadequate staffing has grounds for criminal and civil prosecution under the Federal Civil False Claims Act. The innovative project will bring in an estimated $6,250,000 in revenue to Wellstar Ackworth Health Park. With the employment of new office staff members, there will be an increase in the collection of patients' balances, which will result in Wellstar Ackworth Health Park writing off less bad debts. The project is spread over the course of 2 years. The primary uncertainties are the current pandemic and the availability of talented candidates. The external barriers include the current pandemic and issues related to competition among healthcare providers for top talent. With the list of barriers, there are also recommendations for how to alleviate them and be successful. Understanding the difference ethical theories can help employees and practitioners rationalize and recommend the correct actions for any type of situation they encounter. The first challenge will be getting employees to make choices that consider the greatest good for the greatest number. Wellstar could face expensive lawsuits due to negligence for both patients and employees. This can tarnish their reputation. To help alleviate ethical concerns, employees will be educated on making safer choices and the impact their decisions during monthly meetings. Wellstar needs to carefully consider the feedback given from stakeholders. Health systems such as Wellstar must adhere to federal and state regulations about properly staffing employees in order to conduct business. The challenge will be making sure staffing ratios are safe and employees, specifically management, do not attempt to cut corners to save money on the labor budget. During monthly meetings, safe staffing ratios will be reiterated. When addressing virtue ethics, employees may have differing personal codes of conduct or lack an understanding of how to act morally. To mitigate this challenge, Wellstar must set clear guidelines for ethics and what is deemed virtuous in different situations. As shown in Appendix E, the key parties supporting this innovative project are the major areas of Wellstar Ackworth Health Park. The internal stakeholders will benefit from this staffing solution because of the reduction of preventable events such as patient injuries and medical errors, decreased workloads, and better financial performance. The Wellstar executive leadership team was listed in the ambivalent category because they might be concerned with the cost, money, time, and resources associated with hiring the new employees. Through the presentation of this innovative project, Wellstar's executive leadership team will see increased quality patient care, increased productivity, decreased turnover, and increased revenue through the ability to see more patients. The financial department at Wellstar is the main concern in regard to resistance of this project. The department is in charge of the budget and may see the additional employees as too costly to hire and retain. In order to address their resistance, the management team will need to create a presentation demonstrating the revenue Wellstar Ackworth Health Park could generate with the additional clinical and office staff. Information, data, and metrics will be collected to present to the key stakeholders by the clinical and office staff, along with other areas of the health park's organization identified in Appendix E. The major selling point for this project is safer patient care for both patients and employees. The first step of implementing this staffing solution will be assigning a project manager who will oversee the project from start to finish. The innovative project will require approximately 35 employees and cost an estimated $3,175,000. The proposed additional staff include 3 new physicians, 5 nurse practitioners, 15 nurses, 2 office supervisors, and 10 office staff members. Revenue generated from the additional physicians will offset the cost of their salaries. The most important milestones for this project are listed in Appendix G, along with the targeted dates and business leads. The potential risks of this project are losing the newly hired and having to rehire for the new positions. Proper employee compensation and benefits will play a large role in keeping top talent. The key success factors of this project will be determined by the reduction of medical errors and preventable patient injuries, increased employee productivity, and improved patient surveys. It is estimated that the project will increase efficiency of employees by 23%, while increasing Wellstar Ackworth Health Park's revenue by $6,250,000. Typically, each office at the health park can see 100 patients per day with about 5 clinical staff members, 7 office members, and 5 physicians on average. By adding the 35 members throughout the building, the health park can see over 200 more patients a day by the second quarter of 2022. The project manager will need to monitor the budget by tracking it monthly. Other metrics that will be tracked monthly include employee training, employee performance, employee accountability, and the progress of the project itself. In order to mitigate any problems and keep the project on track, the practice administrator will hold monthly calls with each department and discuss the new employees' performances. All the key decisions will be discussed every quarter and determined by Wellstar Ackworth Health Park's office supervisors, clinical managers, and the practice administrator. Wellstar's executive team, at the recommendation of the practice administrator and project manager, will approve final decisions regarding this staffing solution. This concludes my presentation. Does anyone have any questions?